Those of you who are just joining, we are asking folks to introduce themselves in the chat with your name, organization, what state you're from, and then what excites you about institutional procurement, so we can kind of get a good idea of who's in the room with us. I'm really excited for you all to join us here. This is part of our quarterly webinar series for the USDA Southwest Regional Food Business Center. Today's focus topic is on institutional procurement, and we have 3 great speakers that are center partners who are here to join us. A couple of logistics for the webinar. All of the materials, the recording, the presentation will all be available on the center website, which is southwestfoodbiz.org, swfoodbiz.org. And we also encourage all of you to turn on your cameras and to engage in the chat with us here. Speakers will be answering questions after their presentations, as well as throughout the other presentations if you have any questions, and then we have some time at the end, about 20 minutes for Q&A. So if you have any questions, feel free to put them in the chat and we'll direct them as appropriate, and our speakers will answer them as they can, and then we'll have that longer time at the end of the webinar where you all can unmute and ask questions as well. And with that, I would like to introduce the center's program manager, Tracy Celio.
Good afternoon, everyone, and thank you so much for joining us today. I am thrilled to be able to introduce folks to this topic today on our 3rd Southwest Regional Food Business Center webinar. My name is Tracy Celio, and I'm the project manager for the Southwest Regional Food Business Center, which is a partnership between the USDA, the UC Agriculture and Natural Resources, who is my employer, and then 45 partners across 4 states in California, Arizona, Nevada, and Utah. And we're really focused on this mid-supply chain and building resiliency for our communities. And we have 3 pillars. The first one is capacity building. And so we're working towards building financial assistance through business builder subawards. And some of you may have seen that these subawards, there's a competitive RFA that's open right now in Utah, Arizona, and Nevada. California's will open up in the fall of 2025. And then we also have technical assistance tied awards that are non-competitive that folks working with our technical assistance providers have access to funds to really expand and advance their business acumen and business growth. The second pillar is technical assistance, and that's the piece where we're really working directly with small food and farm businesses and building out that supply chain coordination, working one-on-one with folks, and really just making sure that people that need to come to the table get the assistance they need with partners that have relationships in those communities. And then the last pillar of the Regional Food Business Center is coordination. We coordinate across geographic areas. We have our USDA, other federal and state agencies, tribal agencies. We have our departments of agriculture, and then nonprofit organizations, and really want to serve as a regional hub for sharing out best practices and relevant resources. And this webinar is really one example of that we want to open these up to learn from each other and really just share out some of the work that's being done across the centers. With that said, I'm going to advance to the next slide and introduce our speakers. So we have 3 wonderful speakers today that are all partners of the Southwest Regional Food Business Center. The first is Molly Reardon. She's the Director of Institutional Impact at the Center for Good Food Purchasing. And in her work, she supports institutions and their vendors to align their food purchases with the center's values. She's worked in institutional procurement and value chain coordination for over a decade and has an understanding of those complexities and the potential for values adoption by public institutions, vendors, and also suppliers. Next slide. Maxi Blasini is the California Regional Program Manager for Healthcare Without Harm, and she's got over 7 years of experience in human health, research, policy advocacy, and organizing for environmental justice and climate action. At Healthcare Without Harm, she holds a network of over 150 institutions and then oversees pilot projects that support implementation of those value-based procurement, food waste reduction, and other initiatives at the intersection of sustainability, food systems, and health. And then our last speaker today is Tim Galarno, who is the Food Systems Program Manager at the University of California, Santa Cruz Center for Agroecology. And he oversees a team of staff and students working from the field to the plate and re-envisioning access to delicious and nourishing food for all. His work engages students, producers, chefs, policymakers, and supply chains across California and even beyond to advance the regional and seasonal, small, mid-scale, underinvested producers and enterprise relationships across our food system. And with that, I want to turn this over to our first speaker of the day, and that's Molly with the Center for Good Food Purchasing. Molly, take it away.
Thank you so much, Tracy. Hi, everyone. It looks like my slides are looking a little bit funky, but we're just going to kind of go with it. They look really great. Okay. Hi, everyone. Molly Reardon. In my presentation today, I will share more about the Center for Good Food Purchasing, how we classify what food is good, and how we influence institutions to purchase more good food. Next slide, please. We use the power of procurement to create a transparent and equitable food system that prioritizes the health and well-being of people, animals, and the environment. And we do this through the nationally networked adoption and implementation of the Good Food Purchasing Program by major institutions. Specifically, the Center for Good Food Purchasing works with food service operators and at large public institutions and the communities that they serve to create more transparency about where their food is coming from and how it's produced, and to use that information to align public food dollars with good food values. Two brief notes before I move further. First, why institutional food? Spending on food by anchor institutions like city agencies or school districts, universities, colleges, hospitals, that's roughly, depending on who's counting, 7% of all food expenditures in the US. The vast majority of expenditures are directly from consumers themselves. However, institutions buy a lot of food all at once, so they can send a market signal to their suppliers about their interests. Also, because they feed such broad swaths of the population, they have the opportunity to educate eaters about everything from nutrition to sustainability. So there's a lot of reason to work with institutions. Why public institutions? At the Center for Good Food Purchasing, we have this wild idea that taxpayer dollars should be spent on things that largely benefit the public, or at least minimize harm. So focusing on values that are good for people and the planet means that our taxpayer dollars generate positive externalities while they're doing their primary job of, in this case, feeding people. So this presentation is not going to get into the nitty-gritty of public procurement, but if you're interested, you can either contact the Southwest Regional Food Business Center and let them know that you're interested in that, or you can contact me directly, and I love to talk about institutional procurement. So a little bit more about the Good Food Purchasing Program. It's a metrics-based, flexible, thank you. I forgot to ask you to advance the slides, but Grace is so good. I will do that more, Grace, I apologize. Metrics-based and flexible framework that also offers tools and support to ensure that our public food dollars are invested in food systems that support our 5 core values, which at the Center for Good Food Purchasing are environmental sustainability, valued workforce, animal welfare, previous slide, please, local and community-based economies, and community and health and nutrition, which is all rooted in the principles of equity, transparency, and accountability. Next slide. Here's how we do what we do. We inspire institutions to adopt the Good Food Purchasing Program and commit to values. Then we work with them to increase their purchase of good food within and across institutions. We also help to present a unified and aggregated demand in a way that can drive market change and make good food products available and affordable. And finally, we create bridges between the work of food service operators, community-based organizations, coalitions, policymakers, growers, producers, and national nonprofit organizations that together can build a movement that's strong enough to shift the food system. This is our theory of change for what creates a good food system. Next slide, please. this is what it looks like in practice. One of our jobs at the Center for Good Food Purchasing is to support institutions to meet their commitments to our 5 values. So for example, a school food service director approaches us and we do an evaluation of their food purchases to show where their food dollars are going and how their current food products and suppliers align with our standards through a baseline assessment. Then we assist the district and the local coalition to set some goals and getting these metrics incorporated into a formal school district policy and into their RFPs and contracts. Then we measure their progress toward meeting their goals and celebrate their successes alongside them. Next slide. This is a brief history of the Center for Good Food Purchasing. I want to point out that we were founded in Los Angeles through an initiative of the LA Food Policy Council back in 2011. The Good Food Purchasing program was adopted by the City of Los Angeles and LAUSD in 2012. And in 2015, we spun off because of so much interest in having a metrics-based replicable system that looks at the holistic ways that we need to move to create a good food system. So that's where we are today. Next slide, please. Here's a brief view of where we're working right now in 25 cities and 10 states, plus Washington, D.C. In total, that's over 75 institutions and over $1 billion in annual food purchases. Next slide, please. Here's just a snapshot of all the places we're working right now. It's a diverse set of cities and institutional types. We work with school districts, hospitals, healthcare systems, correction settings, and a variety of other municipally operated programs. I highlighted the places in California where we're working right now in orange. We don't currently work in any of the other states associated with the Southwest Regional Food Business Center, not out of lack of interest. So if you are from one of those states and you're interested in learning more about the program, I'm here for it. Next slide, please. Here's a view of the national partners we work with, including Healthcare Without Harm, where our colleague Maxie, who will be presenting after me, is from. Next slide. And then we also work with local coalitions and local leaders so that we can ensure that good food purchasing values are integrated into the local context. Next slide, please. I'm going to do a super brief overview of how the program works and how we kind of come to our definition of good food. But again, I'm happy to talk more after this brief presentation. The center spent time engaging participants, coalitions, and community-based organizations and leading experts in each of our 5 value categories from across the country. So people who are expert in animal welfare practices, people who are expert in fair labor practices, to ask them for their help to help create clear definitions of good food and how we can determine clear metrics to describe what we mean when we're asking for attributes in each of these 5 value categories. The standards are regularly updated, and the most recent version was released in 2023. So we set minimum targets in each category and provide criteria for what qualifies as good food, but we also have a lot of flexibility for institutions to choose their pathway to get there. Engagement in the program and standards is a journey. Nobody makes their changes in institutional food procurement overnight. We know that. That's why we have a team of technical assistance providers who act as a support along the way because we know that institutional procurement change takes time. Next slide, please. I won't get too deep into this. It's probably also maybe a little bit hard to read, but this slide is an overview of how our scoring system works. On the left, you can see our minimum targets in each category, and on the right, you can see how we define each category. You're going to notice that there are quite a few existing third-party certifications that we use to describe some of what we want to see when we're looking at different attributes like animal welfare or environmental sustainability. And we continue to evaluate those third-party certifications and new ones in order to ensure that they are meeting high standards so that we know that they are meeting the qualifications of good food. So we add them, sometimes we take them away. And we also do locally led verification so that if there's a farm, for instance, that can't do third-party certification because it's expensive or time consuming, there's other ways that the community can help to certify that they're meeting those practices. Next slide, please. I'm going to end here. I've got more slides, which I'm sure you'll all receive if you're attending. I don't know, and if not, you can reach out to me directly. But I just wanted to give you a view of what our program looks like and how it actually functions. On the left, you're going to see the information that we collect from institutions. The middle column is the information that we collect from their vendors. And then the result is a baseline assessment that shows how the institution scored in each of the 5 value categories. This assessment is the tool that my team, the technical assistance team, uses to sit with our enrolled institutions and help them to set goals and figure out the strategies they want to use in order to increase and improve their performance in good food purchasing over time. There's a lot more to talk about, but I am so excited to pass the baton to my former colleague and friend, Maxi Blasini from Healthcare Without Harm. Thanks so much for your time.
Thank you so much, Molly. Always so kind. Molly has always been a great partner, colleague, teammate, and I'm glad that we still get to collaborate and work together. It's wonderful. So with that, hello, everyone. Good afternoon. I really want to start by showing my gratitude to all people here who are present and deeply engaged in this work of systems change through food, which can be, it's challenging and inspiring and all the things at once. So I'm really delighted to have the opportunity to share with you some of Healthcare Without Harm's efforts through the Healthy Food and Healthcare program. And just a little overview of what I will talk about. There's so much we can talk about, but I will go a little bit into the inner workings of institutional food procurement within healthcare. We definitely want to expand on that through more work through the Regional Food Business Center in future opportunities. But today I'll just give a brief overview of the food purchasing guidance of our Healthy Food and Healthcare Standard, and also go a little bit into the healthcare food service and procurement landscape and some of the challenges that are specific to the healthcare sector. And I want to end, if time allows, with a brief example of some successes, some ongoing and future work, and a few tips for producers who might be here, who might be thinking or interested in entering the healthcare market. So a lot to cover in a short amount of time. So let's start with a quick background of Healthcare Without Harm and our work. So Healthcare Without Harm is a global organization and network. It was founded over 25 years ago, and our mission is really to transform healthcare worldwide so that it reduces its environmental footprint, it becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. So what we do, we conduct research, we model strategic interventions, and provide guidance and resources to spread and accelerate good or best practices in the field. And besides food, we have efforts focused on climate and health, safer chemicals, plastics, place-based initiatives, among others. In the US, we have a sister organization called Practice Green Health, and that is our membership program, and it works with a network of 1,700 hospitals and health systems across the US to support them in defining their sustainability agenda and working towards it. Next slide, please. So our Healthy Food and Healthcare program was launched back in 2005, and it's worked to harness really the expertise, the purchasing power, and the investments of the healthcare sector to advance the development of the sustainable food system. This year, our program actually has become less of a single program, and now it's being embedded across all program activities within our overarching US climate program, but our work still continues, and values-based purchasing is really a big chunk of it. So this program and this initiative was really born out of a belief that hospitals are very influential institutions, and they really have a lot of power to affect social, economic, and environmental determinants of health in their communities. And that can and should promote greater sustainability, equity, and health in ways that food not only is produced, but how it's processed, how it's distributed, how it's consumed, and also disposed of. Next slide, please. So in this slide, you can see the framework that has been developed by Healthcare Without Harm and Practice Green Health to help healthcare institutions identify actionable opportunities that support a food system that enables sustainability, health, and equity. And this is what we call the Healthy Food and Healthcare Standard. The standard is really built on a set of core values that are essential to support a climate smart, resilient, and equitable food system. And that includes transparency and accountability, sustainability, racial equity, community health and nutrition, a valued workforce, among others. And I will hone in the food purchasing guidance of the standard in just a minute. But before that, I want to give you a quick snapshot of how all the guidance areas kind of work together, and how that may look like in practice, with a few examples of how hospitals are putting this into action in their campuses and in their communities. So within hospitals, there's the encouraging of local, sustainable, and equitable food procurement through the values-based purchasing framework that we have in our guidance. There's also transforming menus and food environments through Plant Forward Future and Cool Food Pledge, which basically means reducing greenhouse gas emissions emitting foods. And also by reducing waste at the source, implementing food rescue or donation programs, which is part of our food waste solutions. Next slide, please. And in the community, it looks like community anchored collaborations, which I'll talk about that a little bit towards the end of the presentation. It looks like supporting regional food system infrastructure, and that can be done through investments, in-kind support, among others. It looks like delivering community benefits. So nonprofit hospitals have community benefit departments, and they can put a focus on food and deliver healthy food access through farmers markets or CSA programs on site. There's also an opportunity to connect values-based food sourcing to both healthy food access and food as medicine programs, which includes produce prescriptions or medically tailored meals. There's also clinician policy advocacy. They have a huge role to play in this whole systems change movement that we are all a part of. So there's many ways that healthcare can actually influence a food system. And a lot of it is related to food procurement. Next slide, please. So with that little bit of grounding, I want to now do a mini deep dive into our food purchasing guidance that offers a set of strategies and best practices that align institutional food procurement and goals with the core values that I previously mentioned. And these strategies are pretty much grouped into 3 umbrella categories that are sustainable purchasing, local purchasing, and equitable purchasing. Next slide, please. Okay, so here you see the Anchors in Action coalition or Anchors in Action Alliance. So several years ago, Healthcare Without Harm partnered with the Center for Good Food Purchasing and Real Food Challenge, and we formed this alliance called Anchors in Action to pretty much do a cross-sector collaboration across institutional sectors to increase and leverage the purchasing power of all these anchors that we each worked with. And so we came together to align the food purchasing standards and support cross-sector collaboration around values-based food procurement. And so each organization's respective standards, including our food purchasing guidance, the ones that Molly just mentioned in the previous presentation, they've been updated and they use this framework as a scaffolding. So our our standards are pretty much aligned, which serves the purpose of increasing the collective power and leveraging that collective power to move the needle forward in this systems-wide change. Next slide, please. So here you can see from the food purchasing guidance or standard that we have, these are the same 5 value categories that were mentioned previously by Molly. And what we do in our guidance is pretty much help folks identify the products that will have impact on particular values to really support decision makers in aligning institutional purchases and goals. So These purchasing changes, we measure them over time, and that happens through our Practice Green Health membership program. So folks have they voluntarily submit their data, their purchasing data, and they're able to baseline and pretty much benchmark, track how their purchasing is evolving over time and see how that is impacting other sustainability goals that the institution might have. And we offer specifically a guide that has third-party certifications and label claims and which ones qualify under each value category. And we do that just to really support the decision makers on the healthcare sector, institutional, the buyers on that side, knowing the challenges that the sector faces, especially on the time, staff capacity side, to just help them get to those decisions more quickly. Next slide, please. And here, I won't go super into detail here, although I'm happy to answer any questions, but we do have set purchasing goals by value category. There are suggestions. And so this is what is offered in our standard and our guidance. And it also includes additional strategies that can be taken alongside the purchasing to help institutions achieve the overarching goals of each value category. And all of these suggestions and these pretty much metrics or targets are based on prior data from prior sector performance. And for example, just take one, for example, local and community-based economies, we have a 25% total spend that has to qualify under the determination of local, which has a specific set of guidance. And within that, there is also a 15% local spend that focuses on minority-owned businesses, women or veteran-owned businesses. So this is both addressing the vendor diversity, local and community-based economy, and social equity element of procurement, food procurement. So I want to, I've just given you a lot of information that's like very practical, more for the institutional side for healthcare. So I want to take a step back for a second and briefly talk about food procurement in the healthcare sector, because it is a little different from other sectors, right? And each sector has its uniqueness. And with that comes specific needs and challenges. So I want to offer a little bit of an overview of what exactly it looks like. So let's start by revisiting what the food service landscape in a hospital campus might look like. And so there are cafeterias and cafes. There are food and beverage stands or kiosks, vending machines, gift shops, and there's also special events or catering that might take place. Next slide, please. And in terms of who are the patrons, right? We have patients that have most likely strict dietary requirements, and they can be varied. You have staff that can purchase approximately like half of all meals served in a cafeteria, and so are pretty price sensitive to changes in price. And you have visitors who are a little less price sensitive compared to staff, and it's just pretty much more like community members. So hospital chefs and buyers are really balancing the needs and budgets of these different types of patrons. And it's a careful balancing act of navigating cost, dietary needs, and cultural considerations for the community in which they are anchored and that they serve. Next slide, please. And here, we can see a graphic that depicts what the pipeline from producers and growers to healthcare institution looks like. And it's a little messy and convoluted. So I want to spend a minute or two going through why is healthcare purchasing the way it is, and why do they go through all these distributors? So going first through some of the actors, right? We have the broadline distributors, the Cisco and the US Foods. We have the group purchasing organizations that pretty much help healthcare providers, hospitals, nursing homes, home health agencies, et cetera, get savings and efficiencies by aggregating purchasing volume and using that to negotiate discounts with manufacturers, distributors, and other vendors. An example of a healthcare, like a GPO, is Vizient. And I also want to point out that food is not the only thing that a GPO supplies. It can also include other clinical things or clinical supplies. There's also food service management companies, and that's like your Aramark, Sodexo, Compass, And these ones contract with institutions to manage their food service, and there are pros and cons to either scenario, but usually it's easier for if an institution is self-operated to work directly with like local producers and vendors. But more than 95% of hospitals use a GPO, or oftentimes use more than one to maximize savings. So like I said, GPOs negotiate prices, and they also have contracts in place through designated distributors, and pretty much hospitals can have access to rebates by keeping in compliance with those contracts. And so it can make it difficult for hospitals to purchase from someone other than their distributors. Although some hospitals might have they can have off-contract capabilities for a small percentage of like the total food they purchase, and it's generally between 20 and 10 or 10 to 20%. So this makes it a little challenging to go off contract. Food service management companies also centralize purchasing and require the use of preferred vendors that offer them rebates. And so this is one of the bigger challenges with the healthcare sector. It's that in addition to just saving money, the one-stop ordering hub saves hospitals a lot of time. Saving space is also another factor because hospitals can have limited dock space. So instead of having like many deliveries coming into a hospital every day, it's easier for them to just have like a single delivery from one distributor's truck. So these are just some of like the I guess infrastructure and just operation admin level things that influence capabilities for a values-based purchasing initiative within an institution. So going more specifically into these challenges, they often need to purchase really large volumes and need consistency of those volumes. There are storage, staffing, space limitations, and they have specific needs for invoicing and delivery. Thank you. And this connects to the next point. Not many will be positioned to process whole produce or foods in-house. Like they need pre-cuts or lightly pre-processed foods, or they need specific products in order to meet patient dietary requirements. And so this places yet another level of challenge in sourcing directly from local producers. And there's also cost and budget. There are a large variety of hospital institutions. You have for-profit ones, and you also have nonprofit ones. You have publicly funded safety net hospitals, and you also have like affiliated hospitals affiliated to higher education. So there's a lot of differences in the budget of these institutions. Some of them have higher budgets, some of them have competing priorities within a hospital that may need a lot of infrastructure or pretty much equipment changes, and they are pretty much fighting to get a higher budget into their food service department. So many other reasons, and there's a lot of things that are problematic among all these things, and we can talk for hours and hours and hours about this, but there are ways to make change and slowly get there. So I want to just rush through this really quickly. We have an example here of a successful values-based purchasing initiative in healthcare, and that was the Beef to Institution project. So it's been a 5-year-long collaborative project, including Healthcare Without Harm, CAF, Tomcat Ranch, Creamco Meats, and others, to connect large institutional buyers with small California ranchers. And to this point, we've had more than 6 hospitals and 21 school districts being able to purchase from these local farmers. Next slide, please. And a really quick case study. So Stanford Healthcare, they are in contract with Sodexo, but they are self-operated in some areas, and they pretty much got together with other folks in the Bay Area, including people from the K through 12 sector and healthcare, to get together, bounce off ideas, and pretty much they identified that they needed more vendors that could supply sustainable products, and beef is specifically or particularly challenging. And so they gave this feedback to their Sodexo procurement account manager, and the meat vendor that we were working with for Beef to Institution, they were not part of the Sodexo system. However, they're one of the few distributors that have safety compliance and the volume capacity to meet these institutional needs. And after some time and some pretty much requesting it over and over again, they were able to get agreements, and Creamco became a vendor through Sodexo. And so now not only are they supplying Stanford, but now they're also open to other institutions and other Sodexo accounts. So this is just one example of how partnerships that pretty much get together to generate a shared demand, that is like a really powerful strategy to influence systems change. Next slide, please. And just lastly, there are many other challenges, a lot of things that we can't cover just in one presentation, acknowledging that there are infrastructure challenges in the middle of the supply chain that the Southwest Regional Food Business Center is also addressing. And there are other works that we are engaging in to support, to aggregate institutional demand and increase opportunities for community-owned food businesses. Next slide, please. So one project we have in our Anchors in Resilient Communities initiative is a regional food systems partnership that is pretty much catalyzing a processing and distribution food hub to address this issue and pretty much coordinate production, match with demand, and streamline distribution of local producers, local vendors to address some of these market challenges that I've talked about, and that prevent people from entering this institutional market, and also that discourage institutions from shifting their procurement practices. So lastly, very important, and lastly, just want to offer a few pointers for producers and food businesses. If you're interested in entering the healthcare market, it can take a little bit of time, but if we start preparing or setting yourself up for success, eventually that's something that can happen. So one pointer is to do background research on the hospitals. What is the hospital size? What is the number of beds? What are the preferences of the hospital, of the chef or the buyer? What are some purchasing guidelines that some institutions have created? And what is the structure of their food service department? Working on third-party certifications, food safety compliance, acknowledging that these are a process and there are barriers, but if that is a possibility, that is something that can help an institution identify you and your products. Working with food service staff on creative solutions, like setting up a stand in the cafeteria if they purchase your products, so you can help them also generate more revenue, and that increased revenue is helps them buy more of your products and increase their food service budget. And if you are able to use local distributors and broadliners that they work with, if that's a possibility, that's something that can happen. Or identify what are the steps to become a preferred vendor with the hospital if you want to self-distribute. And with that, I want to thank you all for your attention. I know that was a lot. So thank you for bearing with me. I hope this has been helpful, and I'm happy to answer any questions in the chat. And with this, I will pass it on to Tim Galarneau.
Thank you, Maxie. I feel this session is like a matcha chai latte with a shot of espresso. We're getting a lot of information. I'm going to try to move into some concrete examples and findings in a project in the UC across our health centers and campuses. And I think each of us, from Molly's overview and laying the context to Maxie diving in and providing some definition and context across the supply chains, contracted and self-op, and behind the scenes how healthcare sourcing operates, we'd be happy to follow up with you all. We could go to the next slide. So I'd like to just go over our UC University of California Sustainable Food Goals, speak just briefly to some of those challenges, and then dive into a project which we've just wrapped up our first phase on and are moving into a second phase, and speak to some of the next steps as we wrap up our presentations and move to Q&A. So we could move ahead here. So the University of California is comprised of 10 campuses, 5 health systems, and 3 national labs. We've got the breakdown here of our students and our employment in UC. In the healthcare side, we have about 182,000 employees and serve 2.7 million patients a year across our 5 health systems. So the breadth and scope and touch points intersect with a number of our communities across the state. Next slide. And within that, in 2002, we launched a sustainability policy for the University of California. I worked on it from 2004 to 2009 with student organizers with Real Food Generation, or predecessor Real Food Challenge, team members out here to really build a food service section to that, to really recognize the dignity, the ecological, social, and economic dimensions of our procurement, which passed in 2009 and launched into the policy. And we could move to the next slide. Currently, the policy has goals for 2025 and now 2030 to shift 25% of all sourcing to sustainable food products is defined by the Association or the Association for the Advancement of Sustainability in Higher Education and their STARS platform, which intersects with anchors and actions that Maxi had noted in Molly. Our health centers are committed to 30% sustainable food sourcing as defined by Practice Green Health. And system-wide, a 25% shift to plant-based food by 2030 and striving to procure 30%. So there's a number of dimensions of that, and we've been tracking and analyzing it each year with reports from all of our campuses and health centers so we can better understand where we're at. The challenge has been shifting landscapes of what the definitions are in those reporting systems, the training and orientation of our staffs and teams to undertake that, the complicated nature of getting that data from our third-party suppliers and vendors. But you can see there was a trend, an uptick as we're moving through the pandemic, as price spikes happened, as shifts in contracts adjusted. We've been hovering around 20% for the whole UC system right now, going into 2024. And I'll have a slide later on that breaks down the procurement per site, health centers and campuses. So this last year, we launched a project to really build relationships coming out of the pandemic across our campuses and health centers to really map that data collection issues and challenges, to recognize the opportunities and the current barriers for increasing procurement, especially with our small producers and enterprises, advance some case studies and analysis in the system, and ID that tracking and work to date. And we weren't going to do it ourselves internally, so I get to co-direct this project with Agnes Martelet and Marilyn Piscotti that are at the UC Office of the President, but we brought in a team effort, and that includes Community Alliance with Family Farmers, Anna Boba and H. Nieto Friga with Supply Chain, Ben Thomas with Shared Plate Strategies, Amanda Chu, and Jesse James from Real Food Challenge. We really wanted to think about the students, the stakeholders, our community partners, and to bring that wisdom to bear. Next slide. So the arc of the year involved really doing deep dives online with the campuses and sites, doing visits in the winter into spring, and that involved like a 360-degree analysis of their sourcing and contracts, the site-specific and multi-site contract, multi-campus or multi-health center through GPOs, really understanding the supply chains. And then following up with recommendations and ideas of how to start to establish more clear elements for reporting and tracking, as well as advancing procurement towards those sustainable food goals. We brought everyone together in the summer to share this first phase of the work. And I'll speak a little bit more now to this first phase before we dive into what's next. So challenges, let's get real first. So data tracking and reporting, it's a manual process, time consuming. When you set institutional goals, and this is Molly's note of what Center for Good Food Purchasing has been doing, is to help walk institutions through that. We, through our system-wide sustainability office and campus teams and health center sustainability officers and teams, walk the institutions through that process of reporting to the institutional goals and their third-party commitments. And that entire journey involves getting details down to the sourcing specs from the vendors. And quite often our large suppliers will commit to the accessibility and ability to provide that. But when you do contact them and check in, that information is really hard to get. It involves a lot of follow-up, and that takes time. Also, the understanding of certifications and what qualifies for our commitments to the supply chains can be really difficult and vary depending on the site, whether it's a health center or our campus. And some of the same suppliers are getting different requirements from their other clients as well. So that seems to be a little bit of a challenge that we've recognized and are looking to advance clarity on going forward. Sometimes the distributors and the larger ones really have difficulty with that tracking and reporting and the follow-up on that. the cost increases for the operations, impacts of inflation, also honoring labor and well-being. All of our UC operations that are self-operated, that's 9 of the campuses. One campus, UC Irvine, is through Aramark, are all AFSCME union workers in our food system and our health centers too. So providing living wages in the food sector and building that into the cost of the operation. And then, of course, the need to maintain affordable food for our customers. Next slide. So the insights of the team and community and practice and connecting across the state, we've recognized that there are some opportunities with our software enhancements. So in higher ed institutions, folks have different food service management platforms. Seaboard, Yamex is a new one on the block. Food Pro is the Cadillac of the 70s. They manage the sourcing, the supply, the menus, the dietary work. And often you're building elements about tracking the procurement. There's a operation called Metadata, part of Farm Logics, that we're testing and piloting that's aggregating data across the campuses. And what that's going to do is it's going to allow campuses to look at the items of procurement and spend from their other campuses and seeing if they could do some significant shifts that follow best practices and promising practices and shifting product and menus and their design. For our health centers, we use Key Green Solutions. So Key Green Solutions for all of our UC health centers integrate Practice Green Health standards and report on those. Those standards recently shifted, so that was a little bit of a clunky transition this year that we're working on. And we realized really more training and engagement with the teams around the standards, why we do what we do, what's the meaning around it, how do we build a community that resonates with this work. And then we also need to be thoughtful about the secondary vendor opportunities. So contracts specifically with partners that can be small enterprises. And I'll talk a little bit about the small business program in the UC. In addition to our sustainability goals, our procurement team has an equity strategic goal of 25% of all UC products, not just food, moving from small and underinvested producers and enterprises into our supply chains. So we partner with procurement on the food aspects of that as well. And so that lands us into looking at the larger system-wide contracts or northern and southern site contracts across our produce distributions, across our broadline suppliers, such as Cisco Food Services, PFG, some may be using, or through Vizient US Foods in our health sites. And so we recognize that the work isn't only within the institutions, but the work is in the supply chain and strengthening that reporting and tagging so that our software and our systems can really track what we're doing and know what's going on in a more intermittent basis. Next slide. So just a spotlight across the UC system, this last year, we shifted over 36 million in buying to local, fair, just, humane, ecological through different third-party certifications, of which I think were just alluded to with Maxi's presentation, that we've got guidance through Anchors in Action, through ASHE and Practice Green Health to work with. Some of our campuses have made the success already to those goals. Many of them are walking in that direction and looking to walk in community more clearly. In our next phase of the project, we realize there's some key areas that connect the local pre-cuts, and I know some of our food hub partners are looking at pre-cut opportunities. Our UC announced at the Regenerative Beef Summit in Sacramento this fall, our commitment, we're working on a contract with Cream Co. to commit 400,000 pounds of sourcing across the UC system to Regenerative California small producers. So that's an exciting dimension on the ranch side. So it's not just produce or value-added products. And that the extensive support to determine those products and impacts are part of the work we need to undertake. We recognize that innovation is happening in our food system. The food business centers, RFSI, and other dimensions are creating catalyzation and institutional opportunities to partner with small and diversified producers and enterprises, and that we really need to move the needle forward on the data tracking to be clear what we're really doing and who we're supporting and impacting. Next slide. Promising practices. I'll just quickly lift San Diego and Merced. And Fruit Guys is through Aramark and is contracted, but it's a farm fit program for local BIPOC producers as well. Our small business program allows any campus to partner with any unique direct vendor for up to $250,000 at this time. So next slide. San Diego is highlighting they are proactive with Cisco, with their producers and produce vendors. They request items, ask for small producers. They talk with them on the onboarding before they accept a product, and chefs can order from it. So we found being proactive in your procurement teams to actually get the work done you want to do is essential. Next slide. On the Merced side, traditionally, how we sourced our local BIPOC producers into Merced, it went to Permanent, a local farm broker, into Daylight, into Merced. Next slide. What we found is doing the small business program and stepping out of that markup saved 20 grand in markup through Daylight and allowed that more direct relationship with a value-added aggregator for the institution. Next slide. We also recognize those system-wide recommendations are key. Our TA team gave feedback on a Northern California dairy bid and produce RFPs underway. We provided a rubric and guidance that's a accompanying sheet in the contracts themselves. So like Molly, ready to geek out if you have contract questions. Getting that criteria clear in a matrix to socialize in your bids are important, and the scoring in those bids themselves. We're also looking at how to explore expanding the ceiling of our small business program from 250K to 500K. When we think about regenerative beef or ranchers sourcing from multiple sites, that small scale support might need a higher ceiling. So we're exploring that. Next slide. So what's next in my concluding note? We're going to be expanding the work, going deeper with our TA partners, working with their sites more clearly, calling in the culinary team on the menu cycle designs for executive chefs and production managers, both on a la carte and all you care to eat models. We're also going deeper in community, y'all. Both Molly and Maxie have been part of some great conversations to host a farm to institution convening in April 8th. We'll be reaching out to all the troublemakers out there for that. And as a precursor, as CDFA launches their Food Hub RFP, we wanted to bring folks together at UCSC on March 10th, and we'll be sharing more information through the Food Business Center e-newsletter next week as that registration announcement goes live at EcoFarm. And we are also engaging students as one point. Our students are learning hand in hand, doing the analysis, supply chain work, being the advocates. And I think it's really important to lean into, depending on the institution you're in, the stakeholders that can make a lot happen, and to feel part of the solution and step into that work as they look for leadership ladders going forward. I'd like to open up for Q&A because I know we've got just a few minutes here. Thanks.
Thank you, Tim and Molly and Maxie. What an awesome presentation. Does anyone have a question that they want to lift to the group? Feel free to take yourself off mute.
Yeah, Molly, I had a quick question. I was curious about, you're focused on larger institutions, but you mentioned like critical to your work is engaging with what seems like smaller CBOs and kind of like local leaders. I was just curious about like what that engagement process has been like and what that kind of bridge into like those local leaders with larger institutions has looked like. And like maybe if you could share maybe like a few best practices on the important, like getting local engagement in such big picture decisions, that'd be great. Thank you.
Thanks for the question. I think separate from colleges and universities, where there's a clear group of people with demands, students, they're the customers there, or in hospitals where there's a clear group of people with demands, patients, and hospitals get scored on patient satisfaction. Sometimes there's not an impetus for other eaters and public agencies to make change, especially if you're in a correction setting or if you're a kindergartner. So what we need to do is engage the people who are interested in supporting community health and well-being around a public institution to encourage that public institution to shift their purchasing practices toward good food. And so whether that's with food policy councils, sorry, I was about to start using acronyms and I won't, food policy councils, or with local health promotion groups, nutrition education support groups. Urban ag is often a big supporter of good food purchasing because it all helps to kind of create the ecosystem of good food that we want to see in all different parts of our community. So those are the types of connections we're cultivating, because those are also the people who are saying, hey, we want to see you pass a policy to make this happen. Thanks for the question, Ethan.
A great question. Quickly, we have time for one more. Where can we find more about the March 10th Food Hub convening and Farm to Institution convening?
Thanks, Jennifer. Yeah, we're gonna be putting information out on the March 10th gathering next week. And we've been chatting with folks. So currently both like UCANR and lifting it to the CDFA team at our earlier meeting this week as well with the Regional Food Business Center. And yeah, so we'll add you to that mix as well. I saw your enthusiasm. So we've connected with Nick and your K through 12 team on that troublemaking so far, but it'd be wonderful to ensure you're involved as well.
Thanks, Tim.
Beautiful, great questions and wonderful presentations. You've given us a lot to think about today. And I just want to leave folks with a big thank you and imagine the ripple effects when our hospitals, our schools, our universities are engaging in sourcing locally. The sky's the limit. And I think, Molly kind of summed it up that this is going to reach everywhere. This is big work. And the change is going to occur because of the work that we're all in. So want to say thank you. Appreciate your time. And we will have another webinar in 3 months. You can scan the QR code and sign up for that now. It will be on agriculture and technology. And so thanks so much. Have a wonderful rest of your Wednesday and a good rest of your week.
Thank you all.
Take care.
Thank you, everyone.
Be well.